Welcome to the first Educate and Protect video podcast brought to you by Cavanac. These video podcasts are designed to be short 10, 15-minute questions and answers on current relevant topics affecting your business. Our goal is to help you better understand the present so you can have confidence in the future. Now, my name is Diana Dix. I am the HR Risk Advisor here at Cavanac, as well as your host for today's video podcast. With me is Megan Dickerson, and she is the Director of Risk Control and our in-house workers' compensation expert. Welcome, Megan.
Hi, thanks, Diana. I'm very excited to be here, and I'm hopeful that this video series is going to be really useful for our clients.
I think it will, especially because today we're talking about Senate Bill 1159, which codifies Executive Order N6220 that was signed by Governor Newsom back in May, and it extended workers' compensation benefits to employees who contracted COVID-19 while working outside of their home. So Megan, can you give us a quick overview of the executive order and what should we expect, or what is different with Senate Bill 1159?
Yeah, I can. Great. So you may remember that back in May, Governor Newsom issued an executive order that was retroactive back to March 19th and effectively established a presumption that for any employees that were working out of the home between March 19th and July 5th, which was 60 days from the order, if any employee contracted COVID-19 and tested positive for COVID-19, it would be presumed to be work-related. And the presumption was rebuttable, which meant that we could present evidence that the infection was contracted elsewhere, but in the absence of evidence it was contracted elsewhere, it was going to be covered by workers' comp. There were some caveats with the bill, first and foremost being that benefits would not kick in until other coronavirus-related leaves were exhausted, and that included the emergency sick leave under the CARES Act. So now we have this order that has been expired since July 5th, and what has happened is that the legislature has created this bill, Senate Bill 1159, which the governor signed yesterday, actually. And this bill basically makes the executive order law through 2023. But there are some big differences between the executive order and the Senate bill. The biggest one to note is that the immediate presumption only applies to certain types of first responders and healthcare workers. So, you know, that's probably going to be your peace officers, your firefighters, your paramedics, doctors who are treating COVID patients. We'll have to see exactly who gets included in that, because these things usually take some time to, you know, the legislature writes it and it's simple, and then, you know, we have to flesh it out in practice. But for most of our clients, what's going to apply is the presumption that kicks in when you have what's known as an outbreak in the workplace. And typically that's going to be when you have 4 or more cases that are positive within 14 days. For some of our larger employers who have over 100 employees, it would be when 4% of your workforce tests positive within 14 days. Or if the health department comes in and shuts you down effectively. The other thing that is really important to note about this, though, is that even if you have one positive coronavirus case among your employees, you now are required to report it to your workers' compensation carrier within 3 business days. And if you don't, there are penalties that can be associated up to about $10,000. So it's important that employers know that they need to report all of these cases. And honestly, I would say that that's probably a best practice anyway, because the presumption has to be rebutted with evidence. That has to be done within 30 days of your knowledge of the case. And only an insurance company can make a compensability evaluation. So you and I, as the broker, or, you know, if we are an employer, we can't decide that a case doesn't qualify for benefits. That decision has to be made by the insurance company. So a few differences. The key thing to know is any positive cases in your workforce, report it right away so the insurance company can investigate and hopefully defend you.
Okay. No, and that makes complete sense, to make sure that they do report it if they have a positive diagnosis, right? It's not the same thing if it's exposed. They have to have a positive case, correct?
Correct. These cases need to be confirmed by a positive test.
Okay. So with that, my question, since we've kind of talked about what the steps are if somebody does have a confirmed case of COVID-19, confirmed diagnosis, then can you share what would be the obligations of the employer if they have to determine whether it's work-related or not?
Well, okay, so you have a couple of obligations as an employer whenever somebody in your workforce tests positive, right? So first, with any accident or illness, you have to conduct an accident investigation. You want to figure out if there is a root cause, why this happened, a corrective action that you would like to apply. And so the things that you would be looking for in that instance is, are your employees following state and local health guidelines? Are they working remotely whenever possible? If they cannot work remotely and they have to work physically on location, are they staying 6 feet apart from each other whenever possible? And if that's not possible, are they wearing masks all the time? Which I know is kind of a controversial thing. Not everybody loves to do it, but unfortunately it is a requirement under state and local health guidelines, and potentially could be a corrective action if you have an outbreak of cases in your location. So you do have an obligation to do that with any injury or illness. The other obligation that employers have outside of reporting positive cases to the workers' comp carrier at this point is it's important to do contact tracing. You need to identify everyone who was in contact with the infected person for more than 10 or 15 minutes and notify them that they might have been exposed so that they can self-isolate at home. You have the obligation to notify your employees that there's been a positive test in the workplace. You have disinfection and cleaning obligations, and obviously you also have the obligation to initiate any coronavirus related benefits or leaves that would apply to any person who is either positive or exposed. So those are your obligations. And of course, you need to report it to your workers' comp carrier, and you may need to log it on your OSHA 300 log. I won't go into detail on that. We can help you with that. If you have a situation, you can call us and you can talk to our safety risk advisor who can walk you through what needs to be reported and what doesn't.
Perfect. Thank you for that. I think that one of the biggest questions that we had when the executive order was initially signed back in May was, how does this bill, or now Senate Bill 1159, how does it impact the experience rating or MOD?
Yeah, so that's a really good question. Prior to even the governor issuing his executive order, the WCIRB, the Workers' Compensation Insurance Rating Bureau of California, had made a special regulatory filing that made some changes to the way that payroll and claims were recorded when on unit statistical filing. And one of the changes that they made was they said that cases of COVID-19 would not be included in the experience modification rating, which is good news, I guess, if you have an outbreak in your location. But the thing to keep in mind is that just because it doesn't go on the experience modification doesn't mean that you won't pay more premium because of cases. Your insurer has the ability to apply scheduled debits and credits to your policy based on your loss ratio. And also remember that the insurance company definitely did not contemplate COVID-19, just like the rest of us did not contemplate COVID-19. So they didn't underwrite for that risk. They didn't charge premium for it, but now they are, first by executive order and now by legislation, being required to pay out those cases, which means the insurance company is going to be taking on a significant cost they weren't expecting. Estimates have been all over the place, but they've all been in the billions. And whenever there's a significant event, usually we see it as a natural disaster or what have you, but whenever there's a significant event that causes the insurance industry as a whole to outlay a big cost, we do see that translated into increased rates across the board. So you may not have your experience modification go up, which is, great, especially if you're a contractor and you need to be below, let's say, 1 in order to qualify for jobs or what have you. But we do still expect that you're going to see these costs translated into your base rates, and that rates are going to go up across the board.
Yeah. So in order to minimize the exposure, right? I think that this is the requirement. We've got to report it. But what best practices can we leave our clients with as we end our presentation to implement at their workplace to minimize some of the workplace illnesses that may happen due to COVID spread?
Right, exactly. I think the best thing to keep in mind as an employer is that you want to employ all the best practices that you typically employ in order to keep your employees safe at work, right? So you want to make sure that you're following state and local health guidelines. You want to make sure that you're following all the proper social distancing protocols. You want to make sure that you are communicating in a positive manner to your employees, that that they will be taken care of to the extent that you can. If they do test positive, or even if they're not feeling well, that they should stay home. That their job is not in danger if they call out sick, that they're actually, doing their duty and doing, a service to the employer if they stay home when they're sick. Make sure that you're communicating about what sick leave benefits are available if an employee does get sick, or if they have to stay home to take care of a sick family member. The bottom line is that you as an employer have an obligation to provide a safe working environment, and everything that you do in the spirit of fostering an environment like that is going to prevent illnesses and injuries. And of course, when an illness or injury does have, you want to do your accident investigation and see if there's anything that you as an organization can change to prevent a reoccurrence. These things are not only required under OSHA, but they are a best practice for employers, and they are actually the best way to mitigate injuries and illnesses of any type in the workplace. But particularly when it comes to COVID, it's really important to follow all of those infection prevention policy or practices, and to communicate to your employees what kind of benefits are available to them, because the last thing that you want in this instance is an employee who might be afraid for their income or their position, and so they come to work sick and they infect other people at the workplace, So I would just say, just stick to your best practices to the extent that you can, and that is going to be your best layer of protection.
Perfect. And I think that it sums up a very important, I mean, what I take away from that, the key is communication, right? Communicate to your employees. And there's many ways that you can communicate. One, communicating your plan, but also even looking at your that you have. I do encourage you all to visit our Kavanaugh COVID-19 resource page, because there are policy samples. If you're looking to reevaluate your time off policies, your sick time or PTO policies, please feel free to reach out to us. We'll work with you, so then that way you are providing that level of flexibility and communication to your team, because that's going to be a huge key to obviously prevention of some of these workplace injuries and making sure that employees feel safe.
Or even just response if something does happen.
Exactly.
We're unusual in terms of being a broker in that we have invested a lot of money in our risk control team. We have to help our clients with HR, and Dan and I are always here to help with workers' compensation issues and claims. And then, of course, we have our safety risk advisor as well. And we are more than happy to walk our clients through these situations and make sure that they're doing everything they're required to do, and also everything that might be in their best interest. So don't hesitate to lean on those resources, because that's what we're here for.
Yeah, exactly. Where you can find that page is going to be on www.kavanaugh.com. /insights. That's where you'll find your COVID-19 resource page. But if there's anything that you need specific, please again reach out to us. With that said, this session comes to an end of our very first Educate and Protect video podcast. Megan, thank you so much again for sharing your wisdom with us today. And we look forward to having many more. So we'll be sending those out periodically. So watch for them. Thank you again for joining us.
Thanks, everyone.